Hello and welcome. This is Health and Wellbeing on Astro Television, and I am Lois, Abba Sambo. Did you know that tuberculosis doesn't only affect the lungs, but also has a chance of affecting genital organs, most especially the female genital organs, causing infertility in women of reproductive age? The World Health Organization report reveals that about 1/4 of the world's population is infected with tuberculosis bacteria. That is a whopping 1.9 billion people. However, only a small proportion of those infected will become sick with tuberculosis. And so far, about 10.6 million people have fallen ill with tuberculosis, with about 10%, which is 1.6 million people, dying from tuberculosis, and that report is from the year 2021. Today on the program, we will be discussing tuberculosis and how it affects the female genital organs. Taking a sample of people's opinion, it showed that a number of people had no idea that tuberculosis also affects the genital organs.
I don't have much knowledge. I just have a layman knowledge that it's a very, very dangerous disease, sometimes even more dangerous than HIV/AIDS.
But have you had any information concerning how it affects the female reproductive organ?
No, as a non-medical doctor, I don't have a deep knowledge about it.
Tuberculosis is an infectious disease which affects the lungs. And if not treated, it could result to something serious in the body because it comes with cough. And it will also be contacted because it's a bacteria.
And just like a number of these people, a huge part of the population are not aware of how tuberculosis affects their genitals. Well, today on the program, I have some experts who will be enlightening us on this and how to prevent ourselves from getting infected. Today on the program, I have Dr. Omayeli Sesere, who is the Leprosy and Buruli Ulcer focal person at the National Tuberculosis, Leprosy and Buruli Ulcer Control Program. You're welcome to the program, Dr. Omayeli. And I also have Dr. Aderonke Agbaje, who is the Director and Chief of Party TB Local Organizations Network 3, and she is also the coordinator of non-PEPFAR projects at the Institute of Human Biology, Nigeria. You're welcome, Dr. Aderonke.
Thank you for having me.
And thank you for being on the program today. So straight to our discussion, tuberculosis. First thing that comes to mind is coughing, whooping cough.
Yeah.
Yeah, but I'd just like you to tell us in layman's terms, what is tuberculosis?
So tuberculosis is a bacterial infection. Bacteria is an organism basically that you see under the microscope, and it's the genesis of this infection. It can be transmitted from person to person via airborne mechanisms. So anything that would get the bacteria from the infected person into the air can, cause infection in other people. And then, of course, it presupposes to say that virtually everybody should be infected, right? But that is not so, because there are other peculiar things in different people that make them vulnerable, basically, to getting infected with tuberculosis. Anything that will depress the immune system, malnutrition, poor hygiene, crowded areas, living in a house that does not have enough windows and ventilation, all those things. Poverty, of course, which contributes to malnutrition as well. So all those things in an individual will make them more vulnerable to getting infected from other people.
It's so scary, because when you say airborne, I remember when COVID, the outbreak of COVID, and one of the things was like, it's airborne, and everybody got so scared. It was like, everybody is going to get COVID. Yes. And this is very similar to COVID. In fact, I remember during the COVID time, there had to be advocacy for, you have to check that cough. It may not be COVID, it could be tuberculosis.
Yes. That's true.
And just like I said in my introduction, over 1.9 billion people are said to have been infected with tuberculosis, but not all of them come down with it.
Yes.
Please help explain that to us.
All right, thank you so much. So just as she said, tuberculosis, a lot of people are infected with tuberculosis, but they don't come out with the active disease. That's because their immune system is able to fight off the disease. So what that means is a person can be tested and they can find tuberculosis. In fact, quite a lot of people. There are some specific screening tests that we can do, and you can find the tuberculosis bacteria in your body, but you don't have the active disease. It's when a person has the active disease, that the person has signs and symptoms of the disease, that the person can pass it from one person to the other. Again, if your immune system is right, intact, you don't have issues with your immune system, you are not likely to come down with the active disease. So it's not something to be scared about. So you can even be in a place where a person that has tuberculosis, maybe cough, and you don't know, right? Because we enter public transports, we go to different places. But for most people that have their immunity intact, their immune system is intact, they would not come down with the active disease. That doesn't mean we shouldn't do what it takes to prevent the disease. But I'm saying that so that we don't get scared. And then there's not this hysteria about, I can get to black, I can get to, no. If you do, the proper preventive measures, you're most likely not to come down.
Okay, so you spoke about signs and symptoms, so if you don't come down with the signs and symptoms, you may not know. Just give us a rundown of what are the signs, what are the symptoms, what should we look out for to know if I have tuberculosis or not?
All right, thank you. So as she said, tuberculosis can most commonly affect the lungs. So the signs and symptoms, the common signs and symptoms that we know of tuberculosis is symptoms that have to do with infection with the lungs. However, tuberculosis can affect different parts of the body. Just as you rightly said in your introduction, it can affect the female genital organs, can affect the kidney, the bones, the brain, different parts of the body. But most commonly, we have the lungs. So the symptoms that you would see with a person that has active tuberculosis diseases, first of all, what we call chronic cough. So we say cough of 2 weeks or more. So if the person has been coughing for more than 2 weeks, then we say that's a symptom. We also say low-grade fever. So when there's low-grade fever, we say that's another symptom. There's something we call night sweats. So when a person sweats a lot at night, that's another symptom. And then another symptom is weight loss. So unexplainable weight loss. So not the normal weight loss, if you're deliberately trying to lose weight, it doesn't mean you have tuberculosis. But when you've lost a considerable amount of weight over a period of time, and then okay, fine, this is a symptom that you need to check out, it might be tuberculosis. So these are some of the symptoms. There are other symptoms, but these 4 are the most common symptoms that we check for when we say pulmonary tuberculosis, which means tuberculosis of the lungs.
Okay, so now let's delve into tuberculosis and how it affects the genitals. Dr. Omayeli was saying it affects not just the lungs, it could affect the bones. I'm really just hearing, some other parts. But today we're focusing on the genitals. In what ways, or let's even start with how does it get to, because it's like, what we know is it's the lungs, it affects your breathing.
Yes.
And then, so how does it get down there? Most especially for us women, quite a number of us are hopeful to actually get pregnant and have children one day. So getting to know that this could also affect us and also cause infertility is something that is very scary. But how does it get to that point?
Okay, so as Dr. Omayeli said, tuberculosis could either be in the lungs or outside the lungs. Those are the 2 broad categories. One of the genitals, either male or female, but we're focusing on the females today, is a type of what we call extrapulmonary. That's in other places outside the lungs, tuberculosis. And it usually comes over 90% of the time it's secondary to a primary lung infection. So what that means is that the person most likely already had tuberculosis in the lungs, and then the bacteria were carried by the blood into other organs in the body, and the genitalia is one of those organs. And then the other less common way is what we call tuberculosis of the abdomen. It's another type of bacteria that comes from animals that causes that, and that arises when you drink unpasteurized milk, untreated milk, basically. But that is no longer common in our environment. But in maybe very rural areas where they still drink milk directly from the animal, and if that animal is already infected with that bacteria, then it could go straight into the abdominal system right straight into the abdomen. So it really doesn't have to go through the lungs. But from there, we have other vessels that can carry it to different organs. Okay. So those are the two main ways that it can get into the genitals. But most likely, there will have been a primary lung infection.
So would we say that that's a complicated form of tuberculosis?
Not really. It's just a different organ that it is affecting. Yes.
So let's talk about the symptoms.
Yeah.
What do you see, or how do you feel? What would you feel in your body for you to begin to think or reason, are you sure this is not affecting my genitalia?
Okay. So for tuberculosis of the genitals, as you can imagine, for most people, it's an incidental finding because a lot of people, maybe the lung infection wasn't well treated. They didn't take the medicines for the period of time. And then the bacteria goes into the genital. So they may not know. In our own climb, where we say there's a lot of tuberculosis, is basically endemic. We have, we have it occurring more in women of childbearing age. In other climes, they have it in perimenopausal women. So the way it is most often detected is when women are trying to get pregnant. Yeah. That is the most, when they're having issues with fertility. Yeah. So that's why I said it's usually an incidental finding. So that's the most common presentation at the hospital. The other ways one could know is maybe for young women that are having irregular menstrual or abnormal menstrual periods. Either it's the number of days, some don't even get to have menstrual periods at all when they're supposed to, or the duration, the number of days, the heaviness of the flow, etc. Another way it could show is lower abdominal pain. It's usually described as a very dull pain, and that pain probably would have lasted for a long time and does not respond to the regular medicines or the regular antibiotics. The person just knows that I've had this pain for a long time. And for some, depending on how the bacteria has infected the genitalia, they have low abdominal swelling as well. So those are the regular, and of course there may be the other symptoms that Dr. Sesere talked about, chronic cough, the feeling of being unwell, the person is just unwell, maybe they would have treated for different things and the person just isn't getting better. So those are the common symptoms, but the most common is infertility or subfertility.
Okay, so when you say sub and infertility, I still want us to understand, or I'd like to understand better, is this treatable? Is this something that can be reversed, or if it happens, that's it, I'm done for?
All right, so thank you for the question. And I'll say yes, it's treatable. One message we always pass across when it comes to tuberculosis is preventable and it's treatable, it is curable. So unlike some other diseases, even if when you take medicine, sometimes you have to be on those medicines for a long time, all through your life. But for tuberculosis, if you take the drugs that you're supposed to take, the way you're supposed to take them, the way the doctor prescribes, most tuberculosis is treatable. So that's the message you always want to get across to everyone. So for a woman who is diagnosed to have tuberculosis of her genital organs, yes, it is treatable. As Dr. Aderonke said, for most women, the symptoms you would have when a woman has tuberculosis of the genital organs are symptoms that are common with other diseases. And so like chronic pelvic inflammatory disease, PID, which everybody knows about. So the person will have those kind of symptoms like abnormal vaginal discharge, pain, all that pain when having sexual intercourse. But the thing that will make it different is that the person probably would have used antibiotics over and over again and has not seen any change. So we're saying this so that just in case you are in that situation where you have used antibiotics over and over again, you should think about tuberculosis. So if the person is investigated and it's found out the person has tuberculosis, then we have treatment for tuberculosis, which we usually for 6 months. So to say it in the most acceptable way, I don't want to use medical jargon. Yeah. We have drugs, about 4 drugs that you take for 6 months, depending on the kind of tuberculosis that, is diagnosed that you have. So we have different kinds. We have what we call the drug susceptible tuberculosis. That is, it is susceptible to drugs, the first line drugs. This is medical jargons. But we have other drugs that we use for other kinds of tuberculosis. But the main point is that, yes, if a woman is diagnosed to have tuberculosis of genital organs, there are drugs that she can take, and then the tuberculosis will be gone. Now, if it has gotten to the point where it's infertility, there are treatments for infertility, such as surgery. So one of the complications of tuberculosis of the genital organs is what they call adhesions. So that means parts of the womb are joined together because of, the infection. So what they can do surgery to remove the adhesions. There are other things that can be done. So if a woman is diagnosed to have infertility from tuberculosis of genital organs, all hope is not lost. With proper treatment and then, surgical treatment as the case may be, the woman can subsequently have children.
Okay, so because I wanted to ask, now that Dr. Omayeli has said this, how does it work, or how is it, how do I put it? When it affects the genitals, does it mean that wounds or something happens and then it locks up the wound, or is it lumps? Like, what happens to the fact, what happens to the, I think that's the fallopian tube or something. Okay. Yeah, what happens to it that makes it, get to that point where it's either so fertile or infertile?
Okay. So for tuberculosis of the genitals, and as with all tuberculosis, the trick is early detection, diagnosis, and treatment before it gets complicated. And tuberculosis in any part of the body could get complicated. Yes. And it actually kills. And this is very sad for a condition that is treatable, yes, and it is curable, yes, and the medicines are readily available. Yes. You don't have to pay for them in the country. So we're saying that once you have any of these symptoms we have mentioned today, immediately go to your health provider to seek for help. Now, for TB of the female genitals, it could affect any organ in the female genitalia. But the most common organ it affects is the fallopian tubes. It's said in over 90% of cases where TB genitalia is diagnosed, it happens in the fallopian tubes. Now, there are many things that it could cause. It could cause adhesions, as she mentioned earlier. It could cause some infection. I don't want to use medical jargon. That could cause some swellings that would occlude the lumen through which the egg is supposed to go. It could just cause damages to the fallopian tubes. The second most common part it affects is the uterus itself, the lining of the uterus. So it could do so many things, cause quite a bit of damage, infection, adhesions, etc. And at times just makes it unfavorable for the baby to implant, right? It could also, another place it affects is the cervix. This is less common. And then it could also affect the external female organ as well, which usually occurs from sexual intercourse most of the time.
Now you take me to my next question.
Okay.
Because it affects the female genitalia.
And the ovaries as well, sorry.
Yes. And the ovaries as well.
Yes.
This is serious.
Yes.
But can now, when it affects the female genitalia, can it be transmitted via sexual intercourse?
So you're asking, I think, two different questions. Okay, so let's take the first one. Is tuberculosis transmitted sexually?
Yeah.
So that's a question a lot of people ask.
Very uncommon.
Yes, very uncommon. So there are diseases that we know that we term sexually transmitted diseases.
Yeah.
Tuberculosis is not one of them. So tuberculosis has its pathway where it can spread. However, there have been documented cases where it was passed by sexual intercourse, but it's very uncommon and is rare.
And it's usually from the man to
the woman,
actually.
Not from the woman to the man.
No, not
yes.
Okay. So I think that answers it better. It's very rare.
Very rare.
Because one of the reasons why I asked that question is because when we say it now affects the genitalia, does that mean that it now stays there or something? So it makes it a lot easier to be transmitted, looking at it.
So by the time it gets to the genitalia, and because of the way the infection manifest in
Yes.
that area, it's not really in fact, a lot of the tests they've done showed very low concentration of the bacteria in that area.
It only just
compared
does
to
the
the
damage
lungs.
to it
Yes,
than
most of it is the damage.
Yes,
Okay,
yes.
okay.
And I think just to ride on that, you know, there's a lot of stigma and discrimination when it comes to tuberculosis.
Yeah.
And this is mainly because people do not understand what tuberculosis is, how it can be spread. So we've had cases of people who say, my husband doesn't want to sleep with me, I have tuberculosis. So it's not a cause for you not to sleep with your husband or sleep with your wife because of tuberculosis. In fact, if a person has been diagnosed with tuberculosis and has been on the drugs, taking the drugs regularly the way you're supposed to, we say that after 2 weeks on the drugs, the person has taken drugs well, the person is not likely to transmit to another person. So once a person is diagnosed and the person takes their drugs well, then the person becomes less infectious or less contagious to other people. So it's not a time for us to run away from people that have been diagnosed with tuberculosis. With the right treatment and then the proper preventive measures, it won't be passed on.
Okay, so at this point, we'll just take a video of some tuberculosis patients that have been treated and they share with us their experiences.
My name is Aderonke, and in 1998, I was diagnosed with tuberculosis, pulmonary tuberculosis to be exact. At the time, I was still in the university. I was in my year 2 when I was diagnosed with TB. Actually, I was coughing, taking different cough syrups and stuff to end it. But I also realized that it was accompanied with fever and I was losing weight rapidly, very, very rapidly. Then I was a smoker actually, and I attributed it to smoking. So I went home to do some checks. School at NTBLCP University, so I had to travel way back home to do some checks. And then I was diagnosed with tuberculosis. As of that period in time, there was no known cure for tuberculosis yet. So I was really scared I was going to die. A few months back, I had an in-law who died because of tuberculosis. So I was really, really, really scared. And then when I went to the hospital, St. Luke's Hospital in One, I got some information that gave me some hope. There was this organization, the German Tuberculosis and Leprosy Research Organization. They wanted to carry out clinical tests on a new wonder drug, purportedly that could cure tuberculosis. And the center was St. Emmanuel's Hospital, Leket. So I went there. I was admitted into the isolation ward of the hospital, and I started taking their drugs. Actually, I was told I was the very first person in Nigeria to take those drugs. I stayed there for 2 months. And the third month, actually I was supposed to stay there for 3 months, but because of the rapid way I was improving in my health, they conditionally released me to go and take my exams so that I wouldn't have to repeat another year in school. So I took my drugs with me to school, took my exams. God willing, I scaled through, and I kept coming back every month to refill my exam or my drugs till the whole 6 months was over. And here I am today. Stand by. Coming to you in 3. In 2, in 1, kill her. I will tell you, if you have any symptoms of tuberculosis, go to the hospital. The drugs are free. I didn't pay a dime for it. The drugs were free and they work. Tuberculosis is no longer a death sentence any longer. I'm a testimony to it myself.
Welcome back and thank you for staying with us. If you're just joining us, this is Health and Wellbeing on ASO Television, and I am Lois Sambo. I've been here with Dr. Aderonke and Dr. Omayeli, and we've been discussing tuberculosis and how it affects the female genitalia. Now, continuing our discussion, we've spoken about a lot of how it affects the female genitalia, but it's good that we also talk about tuberculosis itself, because before it gets to the genitals, it's actually had to come in, you know. Let's talk about how people actually contract tuberculosis and what people need to do to make sure that they prevent themselves from getting tuberculosis.
Thank you very much. So for tuberculosis, we are all exposed because it is airborne. So if someone that has the tuberculosis disease, that's the active disease, either coughs or sneezes or sings or talks, you know, there's that risk of spreading, getting the bacteria out one way or the other. And then those of us around that person, we are also at risk of, you know, inhaling the bacteria. So the key things are, first of all, as I said earlier, if you have a friend, a neighbor, a family member, a colleague that you see has been coughing for 2 weeks or more, please let us encourage them to seek help at their nearest health center. We have, I think now we have over 7,000, I believe, or 13,000 hospitals in Nigeria that can treat tuberculosis, and many more that can diagnose and refer for tests. Then cough etiquette is very important. You know, if you know you're coughing, try to, you know, cover your mouth, you know, cough into your elbow, so that reduces the transmission, you know, the aeration of the bacteria. So that is very important. Of course, hygiene. We have to make sure we're in a clean environment. We keep our windows open. As much as we can, reduce the number of people that sleep in the same room, especially when one of them is coughing. Keep our windows open. Eat, you know, as you know, fruits, vegetables. Keep our immunity up. And whatever we have, there are other illnesses, of course, that because they are immune, they are illnesses that suppress immunity. You know, they are likely, the person is likely to have tuberculosis, like HIV, those that have diabetes mellitus, children that are malnourished. And children are a special population because they may not even exhibit all the symptoms we're talking about. But when you notice that a child is just generally unwell, you know, just losing weight, in babies we call it failure to thrive. So you're feeding this baby, and this baby is not, you know, putting on weight and looking as bright as they should. So those are the things that should lead us in that direction. Of course, I talked about cough etiquette as well. So these are the things we need to do to prevent.
So I'd like us to talk about the treatment. We have as many hospitals as possible that can treat. How accessible is this treatment and how affordable is this treatment, and where can at least the most common man go to access this treatment?
All right, thank you so much. So the National TB Program, with the support of many partners like IHVN, Dr. Aderonke is in, and some other partners, have ensured that we have the populace has access to TB testing services in as many offices and hospitals and health centers as possible. Now, most health facilities are sensitized to the fact that if a person comes with cough, weight loss, and all of that, they refer them to what we call the DOTS clinic. So where they will do, their sample will be taken, sputum will be taken, we call it sputum, the specimen that is tested, and they will be investigated for tuberculosis. If diagnosed, those centers will also provide the treatment. If it's complicated or what we call drug-resistant tuberculosis, they are referred to, we have drug-resistant treatment centers all over the country, different parts of the country. They are referred there, where they are placed on admission if need be. If they are well enough, then they can be given the drugs and then they go home and come back. So yes, so most public hospitals, in fact all public hospitals, once you show up with those symptoms, they have what we call the DOTS clinic, where you'll be sent to, your specimen will be taken. And we emphasize that this is free. So tuberculosis management in Nigeria is free, or let me say tuberculosis treatment in Nigeria is free. Also, quite a number of public hospitals have been engaged to provide these services. So once you have any of those symptoms and you walk into a hospital and you tell them this is what you're going through, they will refer you to the right place where your sample or specimen will be taken, and then you will be checked if you have tuberculosis. And then if it's found out that you have tuberculosis, then they will take you to the treatment and some other things that are needed. So
you mentioned something that triggered me, and you said resistant tuberculosis.
Okay.
How do you get to that point where you're tuberculosis? And I believe that means that it's resistant to medication. How do you get to that point? Am I right?
So yes, you are right, and you are right, but there is more to it.
Okay.
Yes.
Okay. So how does tuberculosis get to that point, and then how do we treat it from there?
All right. So we have the tuberculosis can either be sensitive. Let me use the word sensitive to what we call first line of drugs. So just like you have malaria, when a person has malaria, usually the first line they give is Coartem, right?
Yeah.
We all know Coartem, Lonart. Now, there are some of the bacteria that when you give this drug to, which is like the first line drug, there are some drugs we call first line, it will not work because the bacteria has developed, will I say, immunity, for lack of a better word, to those drugs. So we have some other drugs that we give those kinds of people. So once a person is diagnosed to have tuberculosis, the next thing we're checking for is what kind of tuberculosis is it? Is it the ones that are sensitive to the first line drugs, or is it the one that are resistant to those drugs, and we need to give another kind of drugs? In either case, there's nothing to be scared about. Once a person takes the drugs, right? Because sometimes you realize that fear prevents people from even accessing services. So once you take the drugs, then properly, then you probably, be cured, and you will get better. So those are the two kinds that.
Because when you say resistant, it's resistant. The first thing that comes to my mind is, okay, so what medication would you take if it's resistant to it? But before we wrap it up on the program, Dr. Aderonke, I'd just like you to give us, just share with us so far what IHVN has been doing, in the fight against tuberculosis, and what are the gains that we've had, especially relating it to Nigeria so far in curtailing the spread of tuberculosis in the country.
Thank you very much. So IHVN has been partnering with the National TB Program for over a decade now, I think about 14, 15 years in fighting TB in Nigeria. And we've done that through various donor-funded projects. We've had the PEPFAR projects supporting the TB HIV program in Nigeria over many states. We've had the Global Fund project. We've had some research projects. Currently, and initially we had the Global Fund project for multi-drug resistant tuberculosis.
Okay.
Yes. So we're able to scale up multi-drug resistant tuberculosis services to all the local governments in Nigeria and several tertiary and secondary hospitals. So as she said, we can confidently say in Nigeria now that 50% of hospitals in Nigeria can adequately take care of a TB patient, both public and private. So we are not just limited to public hospitals. And not just hospitals, through our current Global Fund public-private partnership grant, as well as the USAID TB Loan 3 project. The public-private partnership project is in 21 states, and the Loan 3 is in 4 states. Through this project, we were able to diagnose over 50,000 tuberculosis cases to report to the national program in the last 1 year. And through this project as well, we even have non-traditional, non-regular health providers like traditional birth attendants. We have patent medicine vendors. We have over 30,000 patent medicine vendors, you know, under the IHVN project that can have a very high index of suspicion for tuberculosis. Usually, when people go to them with cough, they will just put together their medicines and give to the person. But now they are able to ask, I gave you cough syrup last week. Let me tell you, you know, call someone that will collect your sputum to go and test and then get the results for you. And if it's TB positive, that same person will escort you to the nearest health center. So you don't even have to travel miles, except it's just your preference. You'd rather go to a public or rather go to a private facility. So all those things are in place through the projects we're implementing. And we've screened, in the last 1 year, we screened over 12 million Nigerians. Our project supported the screening of over 12 million Nigerians for tuberculosis. So now we're not even just waiting for people to come and say, oh, I have cough. You know, wherever we're working in collaboration with the National TB Program, our state TB programs and other partners, World Health Organization, etc. When people come to the hospital, we now actively ask them, how are you feeling? Have you been feeling unwell? Including people that accompany people. We've even diagnosed TB in people that escorted ill people to the hospital. They weren't coming on their own. People in the marketplaces, people in beer parlors, people in orphanages, even in the prisons. We have, you know, our projects now support volunteers to go to the prisons and to support screening of inmates, correctional centers, sorry, and support screening of, you know, inmates to ensure that they are not spreading the tuberculosis to their other inmates. And we have found cases.
Very important, most especially at the correctional facilities, because you know they're in confined spaces and always up in each other's spaces. But there's something I wanted to also find out. For private health centers or health facilities, is the treatment free as well?
Yes.
Oh, okay. That's interesting. Tuberculosis
treatment in Nigeria as it is, we thank government, we thank the leadership by our National TB Program, the advocacy and engagement process. We thank our donors as well in Nigeria that are helping to support free diagnosis and treatment for tuberculosis, which otherwise would not have been affordable for the common man.
So now this is from the entire program now. How has Nigeria fared so far? And okay, quite a number of diseases, you know, there is always the 2030. I don't know if tuberculosis also has the 2030 target. How has Nigeria fared so far? And are we on track to meeting that target?
All right, so thank you. So it is not hidden, let me say that, tuberculosis is in Nigeria. Tuberculosis is in Nigeria. In fact, a lot of people have forgotten that tuberculosis exists. Maybe because it doesn't affect people who are maybe well-to-do or whatever, because we say it's a disease of poverty. Even though people who are well-to-do, if they have other risk factors, can also get it. So tuberculosis is in Nigeria, and we need to tackle it. That's the important thing. However, we as a country, it is said that we have over 440,000 cases of tuberculosis in Nigeria every year. And so our drive as a national program is to ensure that we find out those cases and treat them on time so that they don't spread the disease to other people. As Dr. Aderonke said, early diagnosis and treatment is key for us as a program, as a national TB program. Now, over the years, we have really doubled up efforts with the help of support from partners. And as of last year, we're able to diagnose over 280,000 of those cases out of the 440,000. Now, what that says is, yes, we're doing, we're doing well,
better,
I would say, we're trying, but there's still a whole lot more to be done, right? And this is because every case of tuberculosis that is not diagnosed can affect up to 10 to 15 people in a year. So any case that exists in the community of tuberculosis that we don't detect and then we don't start treatment for on time can spread it to about 10 to 15 people within each of our community. So that's a serious. So you can imagine the over 100 and something thousand cases that we have not gotten that can spread the disease right and round. One of the reasons why we are not even getting those cases is, as we said earlier, stigma and discrimination. People don't want to come to be tested for tuberculosis because they are afraid of tuberculosis and what other people will say. So we're saying it's important that people access these services. These services are readily available. If you notice any of those symptoms, or if anybody around you has those symptoms, please ensure that they come for the tests. And then if they are diagnosed with TB, they take their treatment so that we can reduce the burden of tuberculosis in Nigeria.
Well, thank you very much, Dr. Omayeli, for taking our time to be here with us on the program. And thank you very much, Dr. Aderonke. I sincerely appreciate your presence on the program today. Well, that's how far we can take on the program. Do remember that if you cough for more than 1 week, more than 5 days, please go to the nearest health facility to check if it's tuberculosis. It would go a long way in preventing about 10 to 15 people from coming down with tuberculosis. That's how far we can go on the program. Please do keep it a date with us. Same time next week. I am Lois, Abba Sambo. Do stay safe.